Thank you. Good morning, everybody. My name is Margot, and I am a fifth-year medical student right here in Groningen. I am currently enrolled in my clinical clerkships, and I will be telling you something about percutaneous needle fasciotomy for secondary or higher recurrence in Dupuytren disease. As you all know, percutaneous needle fasciotomy, or PNF, is an effective treatment for primary contractures and first recurrences in Dupuytren disease. Some argue that it's not a viable option for treatment because of its high recurrence rates. These recurrence rates reach up to 85% after 5 years. But what we don't know is what is the effect if we repeat these PNFs on the recurrences. Can we postpone a limited fasciectomy or another aggressive treatment, or can we delay it in total? Our research question is PNF an effective treatment option for secondary, tertiary, and quaternary recurrences of Dupuytren disease? To find out the answer, we conducted a retrospective medical file study. We included patients treated right here in the UMCG from 2007 and 2000 to 2014, and we identified these patients using the operation codes for PNF. Our inclusion criteria were a third, fourth, or fifth treatment with PNF of the same ray. A primary outcome measurement was the reduction of total passive extension deficit, or as I like to call it, TPED, following a third, fourth, or fifth treatment postoperatively. We found out that in our data, 172 people were treated with PNF for a primary contracture. Of these 172, a third returned to us with a primary recurrence. 39 of these 57 people chose another PNF treatment. 18 of them chose limited fasciectomy. Of the 39, 41% returned with a secondary recurrence. 5 of them chose limited fasciectomy and 11 chose PNF. Of those 11, 45% returned with a tertiary recurrence. 4 of them chose PNF and 1 chose limited fasciectomy. So after 4 treatments, all 4 patients who chose another PNF returned, so that's 100%. 3 of them chose PNF for their 5th treatment, and 1 of them chose limited fasciectomy. This table shows the decrease in total passive extension deficit. I'll walk you through it. I have listed the number of treatments, 2nd, 3rd, 4th, and 5th treatment, the decrease in TPED in degrees, with the range in the median, and the decrease in TPED in percentages. And that's the most important part of this table. You could see that even with a 3rd or a 4th treatment with PNF, we get great success rates of 73 and 63%. A 5th treatment is not that successful. Our results show a trend towards less effectiveness at a PIP joint level compared to an MCP joint level. Unfortunately, our groups were too small to have this a significant difference. And by means of PNF, we found out that a more aggressive treatment, like limited fasciectomy, was postponed with an overall average of 4.5 years. In conclusion, this study showed that the effectiveness of PNF for secondary and tertiary recurrences was high. So high even that when you compare it to the literature, even a 4th PNF could have similar results as a primary PNF. So that's a great result for us to see. A 5th PNF, as I aforementioned, was less successful. The strength of this study was, as far as we know, it's the first time that this has been investigated, and we included the largest time span possible in the UMCG. We included everybody treated between 2007, the first time that we performed it in the UMCG, and 2014. So that's the large time span. The weaknesses of this study is the retrospective nature of the study. It gives us poor data, unfortunately, and we found out that a tertiary or quaternary recurrence is very rare in Dupuytren's patients, so we ended up with pretty small study groups. But at least we know a little bit more about the effectiveness of PNF for secondary or higher recurrences. Thank you for your attention.